think about vestibular issues outside of like the benign positional vertigo. Have you learned about that?
Hmm.
Like, I I don't I don't do a lot of techniques like that. Like I don't I just don't feel comfortable with it because I haven't done enough of it. So I'll refer out to that. But think of it as that type of work is sort of like a chiropractic adjustment, or it's like a grade 5 manipulation, right?
Mm.
There's a need for like a high velocity manipulation of some way, and sometimes it like works like a charm, sometimes it doesn't, and there are people just like that. There are people that specialize in sort of the osteopathic manipulations, chiropractic adjustments, grade 5 manipulations, whatever you want to call them. Like that's one piece of it. But then there's the therapeutic part of it, which I think is more like the graded exposure idea that is no different than any of the other things that we do with strength training. We just have to know how to, mildly provoke a symptom and really tease that out. So we do that through, head movements, eye movements, and then positioning too. And then looking at like, okay, what creates the onset of a symptom, but a mild version of it, which is what we're trying to do with pain anyway. And then giving somebody maybe a slightly easier version of that, and getting them to the point where they can tolerate a little bit more, along those lines. So I've had a couple people where I just like have them do, look at a dot, right? Keep your focus on the dot, move your head, and then, follow the finger type of idea, and just try to seek out, is it moving the head left? Is it moving the head right? Is it moving, like, what direction of either head movement or eye movement provokes the symptom the most? And is it one rep? Is it five? You know what I mean? It's getting that symptom profile just like you would do with pain. But the symptoms are often going to be different, and they may be a bit more sensitive. So you just have to be like careful. Like I usually treat those symptoms like I would treat like pretty more irritable pain type stuff, where I'm going to be cautious of how I provoke it, but I still want to get the profile about what brings it on. And that can also often be pretty useful for clients in the same way, where you're showing them that they don't have to like just hold their head in place. It's actually a very specific angle, a very specific movement, very specific actions that produce their symptoms. So now they have a little bit more specificity about what they should be careful with and what they don't need to be careful with, and that can be useful. And then just with exercise in general, it would be like progressions of gazing would be something that I'll use like with or without symptoms. But I often get people that have like a chronic history of symptoms, or they're always cautious of how they move their head, how they get up and down from the ground based on age and history. So I will cautiously have them start to mess around with eye gazing during different activities. Like where, if we're doing balance work, just like focus on one spot, and then it might be, okay, you're getting a little bit better there. Can you bring your gaze up and focus on a slightly different spot? All right, well, you're getting better there. Can you do the same thing and, just look to the right, right? And then can you do that? But that might be like progressed over time. And I'm certainly not someone who is like a vestibular specialist. I wouldn't think of myself that way. So I will refer out for that. But I do think like we sometimes like put systems on a pedestal where ultimately it's a similar process of adaptation no matter what the symptom is like we have to be able to get people to tolerate gradually more by having that graded exposure type of approach. And I think the vestibular system is no different. We just have to know like what are the things that we're trying to manipulate. And a lot of times it's head movement, eye movement, and then speeds. Like speeds really matter, right? Because someone can move really slow at first and that brings their symptoms on. That may go away, but then you got to be like, okay, can we like do a medicine ball toss where you have to turn your head and respond to that? And you know what I mean? Like it ends up looking like training, but you just have a different reason why you're doing it.
Mm-hmm. It makes a lot of sense. Yeah, I guess it all comes down to sort of the same principles, just with different specifics.
I think the more you can at least start with the fundamentals, the better, because like the more things make sense. And then there will always be specifics that are important, that matter.
Yeah.
But it can become overwhelming if you don't have that foundation to call back on, where it's like, oh, like you're learning a bunch of new skills instead of you have the framework. You just need to add a little bit to understand like the more specific piece. What have you been learning? Like, did you get some education on that recently? That
We had like a couple lectures about it last week, and I just found it interesting. So, and we haven't talked a whole lot about treatment yet. But like I feel like it's something I haven't had a whole lot of experience just like seeing. So yeah, I mean, just interested in it a little bit, but
yeah, I think in my experience, like you have to be careful. Like people will just have these vestibular systems, and then they'll get a diagnosis of it, and then for their whole life they will just be really cautious how they move their head. And maybe that's the thing, but like I see so many people like that I'm just wondering how problematic that is, where now, like, okay, you always have to have 3 pillows under your head every time you lie down. Like now you can't lie on your right side. And it just seems to me it's like the same type of thing where you tell someone they can't squat and they won't be able to squat. And I don't know, I haven't done like enough case studying in the clinic to know that it's true. I have definitely seen people be able to tolerate lying down better and things like that, just by progressively, like, you know, removing pillows and just getting them on the ground more frequently, and making sure that they're starting in the position that they're most comfortable with, and then just having them like respond to different exercises by moving their gaze, and that has helped. So but I don't think you need to like focus too much on it unless like the symptoms are just like really, really limiting, and that's possibly where a specialist would be better, because they might know what to do if things go like real bad, where I wouldn't feel as comfortable there. Like I wouldn't want someone to come in if they're having like fall down on the ground vertigo symptoms. Like I just wouldn't feel like that I would be able to help them or feel as comfortable there. But mild symptoms with head and eye movements, like I think that just fits right into sort of the training continuum.
yeah, absolutely. Yeah, I feel like that's such a theme. I feel that we always touch on is just coming back to the general principles as much as you can.